All right. So, hello, everyone. Welcome to this edition of the Engage Africa Foundation Fireside Chat. We have our distinguished team members from representing several African countries and several areas of expertise. And today we're going to be exploring cross-cutting strategies to promoting um, healthier, healthier living in Africa, promoting health in Africa. Everyone here is going to bring a very multi-sectoral perspective, and we're going to share some inspiring strategies from our work and our experiences across the continent. So to get us started, we have an icebreaker, and we're going to go around. Everyone is going to introduce themselves and tell us the African countries they visited and the ones that they would love to visit. So we're going to start with Aimable today.
Okay, thank you so much. My name is Adaobi, and I'm from Rwanda, and I'm happy to be here today. Yes, I have visited Burundi, and I enjoyed uh, a fish they mostly call mukeke, I guess. That's the famous name in Burundi. And yeah, that was exciting to have, and I think. Uh, I have been, do I say daydreaming or looking forward to visiting Nigeria and up there. I'm excited so about so many things. Recently, I was talking about how I came to go there with my Yaomi because I'll need to test some of the things with her and then yeah, have good time in Niger. I think when I see the songs, when I see some of the movies and some of the friendship that I have with Nigeria, yeah, it gets me excited to have such experience in Nigeria. Thank you.
Thank you, Mavli. And you can already speak Yoruba, so thanks so much, Mavli. We look forward to having you in Nigeria as well. So we'll go to Osaze.
Thank you, Ebele. Hello, everyone. My name is Osazemen Aghedo, and I'm a team member with Engage Africa Foundation. African countries that I've visited. Unfortunately, I haven't visited much any other African country than my country of birth, which is Nigeria. But so yes, born in Nigeria, I'm a Nigerian, and well, I have a long list of African countries I want to visit. Firstly, I want to visit Rwanda. I have a friend in Rwanda that's promised me that we're going to do a bike tour through Rwanda. So that is top on the things I want to do. So that's one of the major reasons I also want to visit Rwanda and enjoy and experience the culture. So thank you for having me.
Awesome. Thank you, Osaze. I look forward to your bike tour of Rwanda with Aimable. Michee.
Thank you, Ebele, and the team. My name is Michee Nshimayesu from Rwanda. The country I visited is just Burundi and Uganda, but I wish to increase that number of countries. The preferred country in Africa, the first one is Egypt because of the historical background. And the next one will be Nigeria because I have now so many friends from Nigeria, so I want to meet them in person. Yeah, that's it. Thank you very much.
Thank you, Michee. Joyeuse.
Thank you, Ebele. My name is Joyeuse Senga, and I'm also from Rwanda. So I see that Rwandans were representing. So the countries I've visited in Africa, I believe I've done most of the East African countries. So Uganda, Kenya, Burundi. I've done DRC, Tanzania. And then I also just recently did South Africa as well, which was really beautiful. But on my list, I feel like I'm pressured to say Nigeria because I also have a lot of friends from Nigeria. But just to say a different country, I would say Ghana as well, because I've also seen like really good things about Ghana. Most recently, a lot of tourism promotion. So it would be West Africa, Nigeria or Ghana for me as well.
Awesome. Thank you, Joyeuse. Sorry, Joke.
Hello, everybody. Can you see me?
Yes. Hi.
Sorry, I don't have the background. Um, okay, so my name is Ajoke Adebisi, and I'm from Nigeria. Unfortunately, I've not visited any African country, and it's really sad. But I look forward to visiting East Africa. Rwanda, top on the list, Kenya. Those are two countries I really want to go to. And then I really want to go to Ghana. Ghana is not too far from Nigeria. And I'm wondering why I've not visited Ghana. So top on my list, Rwanda, Kenya, Ghana, and then South Africa. Yeah. The only country I didn't get into the country was Ethiopia. It was just a connecting flight. So it was just I stopped at the airports, unfortunately. But I look forward to going around Africa. Yeah.
Awesome. Nice to have you, Joke.
Thank
And
you.
I'm thinking of the African countries I visited. Obviously, I'm from Nigeria. I've been to Ghana. When I went, we drove. So we passed like Togo, Benin Republic. I've been to South Africa. I had a flight delay in Kenya, so then I ended up spending a day there. So I saw a little bit of Kenya, but I feel like there's more to see. Where would I like to be? Okay, Rwanda for sure. I'd love to meet everyone on the team now. I'd love to see more of West Africa too. I'd love to see Senegal. I'd love to see Mali. Um, yeah, so that's me. Thank you, everyone. So look forward to the Nigeria Rwanda exchange very soon in person. So today, with all our experiences of living, working, thinking about, researching public health in Africa, we're going to be exploring different cross-cutting approaches to creating a healthier Africa. We'll be drawing on our team experiences, and we want everyone here to share ideas of what they're seeing working around promoting a healthy Africa. We have a lot of perspectives represented from nature-based initiatives, community engagement, policy interventions, different programs, sporting events in Africa. So we're going to bring all this together and synthesize and see what we can get from this conversation. So we're going to go around and ask everyone to share at least one existing inspiring approach to creating a healthier Africa that they've seen from their own experience. I'll open up the floor and then feel free to join the conversation. Or maybe we'll go in the order that we started before. So, Aimable, we'd love to hear from you about especially your experience promoting health through nature-based initiatives. We know you recently completed a hike. Maybe you can tell us a bit more about that. And also, yeah, just how you created this network of young people hiking different places in Rwanda. I don't know if it goes beyond Rwanda, but you tell us. So you have the floor.
Okay, thank you so much. Yes, we always joke that we go outside of Rwanda because most of the volcanoes we hike borders Uganda or borders DRC, and that's an opportunity to visit a country without a visa or any other documents because we cross the country when we're hiking. And yes, recently we had to hike one of the highest mountain in Rwanda. It is called Karisimbi. And yeah, it was a good experience, but maybe going into the background and experience, I think, or I believe the country has been investing in various initiatives to leverage or to promote healthier lifestyles in Rwanda, considering the growing burden of NCDs that have been increasing not only in roundabouts on the continent and around the world. And with this, we have so many initiatives that have been put to place. Like we have, I think it's not my first time mentioning this here. We have Car-Free Day that mostly happens twice a month, where community members or residents mostly in Kigali, but also this has been expanded to other secondary cities, even other towns and districts in the country where people are engaged in like 2 to 3 hours car-free day event where people are able to run, like they have cars literally stop in some of the roads in the country to make sure people can be able to exercise, either cycling, running, and doing other activities. And this has now become a culture. It's something we own as the country, mostly in promoting healthier lifestyles, because not only that people are able to engage in that, those activities, they were also able to be educated with some of their health awareness education part of it, and also screening to do early detection of some of the NCDs of which people can be able to get counseling, but also be able to be referred to healthcare facilities. So this has been one of the inspiring initiatives that the Ministry of Health, the government of Rwanda, with metro sector collaboration of various stakeholders from transport to Ministry of Health to police and other various stakeholders putting so much effort to ensure that this is maximized. And I've been part of this mostly on the research aspect as a student back when I was in my bachelor education, and got inspired to, of course, to contribute to this as a healthcare provider. I mean, as a healthcare manager, as a global health aspiring student at that time. And now being able to do my research on breast cancer, that was finding an expertise on NCDs now. And being an outdoor person, I've been able to find that one of the, of course, lifestyle that most of the time is affected with our day-to-day work is actually being active, because with the trend of how generations have been changing nature of work, it has been forcing us many generations to not be active. So back in 2021 and 2021, I have started an initiative of using actually the outdoor as another way of remaining physically active, but also work-life balance in a way that people are able to engage in nature-based activities, mostly because it started with me almost burning out with work, and then I needed to find the changing environment from work to other activities. Yes, there is a car-free day. I wouldn't want to wait for like in the city, or I'm working far from the places where car-free day often take place. So I started this initiative of now using the environment around it, be walking around, it be hiking around, it be cycling around. So since that time up to today, I think we have been able to organize 25 hiking adventures in mostly in the part where Visit Rwanda has done so well to promote tourism. And then we connected such component, of course, that the country is doing well as well with tourism, and connected with health promotion, where we're able to make sure people dedicate a time in a month to be able to hike. And then so far, I have realized that it doesn't actually not only help people exercise, it also help people disconnect with their devices, because they are busy hiking, they are busy cycling, and then we're able to network at the end of this hike. And then in that, some of the feedback we have already started to see is how it is therapeutic in a way that not only people are able to exercise, but also mentally they're able to get time off with these devices, and then be able to connect with themselves in the nature, with yeah, being able to explore the country like in that sense. So I would say that I believe maybe we are going to talk this later. It is showing results like yes, this is something worth investing in as nations or as researchers, as healthcare advocates, ensuring that people for sure are able to maximize these lifestyles of where they can hike, which in a way that actually before we hike, we do some other practices to be ready for the hiking. And I have realized that that bring in a way an indirect outcome of people remaining physically active every other week, every other uh, period of time because they are preparing to go for another hike on the next month, and they end up actually doing daily works or working after on Friday after work because they know maybe next week they're going to hike. And it has been for sure raising a community of physically active members who are excited to do this day to day, be able to network, to connect, and yes, to take part in the a movement our country is doing of being one of the hubs of tourism, exploring good places we have in the country. So that's generally how we have been doing this. And maybe I would add that another advantage is that as a researcher on breast cancer awareness, advocacy, and education, we also use such platforms to also maximize on health education, health awareness, which is an inspiration, of course, from what we have been seeing like on Car-Free Day, where not only people are engaged, but also they are educated on the best way to know about their health, to pay attention to some of the symptoms and concerns that may cause conditions like breast cancer or even other diseases that are mostly on the burden caused by NCTs. Pretty much that's how the experience is. And I think maybe, I don't know how you all are doing, but it has been an experience which I believe we can push and back with research and also maximize on the resources that are already there or even platforms like what you have in Rwanda. Thank you.
Awesome. Imame, thank you very much for sharing that. You brought a lot of things. You talked about kind of intersecting, so physical activity promotion, using that as a way for people to connect, for people to promote sites in the country, promote tourism, which has something to also do with economic development, intersecting that with screening for diseases. You talked about getting different sectors involved to even make the Car-Free Day possible. So this is maybe this will even take me to, but well, before we go to another person, where is, tell us one of the most one of the favorite hikes that you've ever done in Rwanda. Where was the site and how, how long did it take? How high was it?
Oh, I would say it's still Karisimbi because it's always exciting to feel that you're at the top of the country. You are at the peak of the country, it being the highest mountain or in Rwanda. And the good thing is also it's one of the only 2 day, more than 1 day hike where you're able to camp in the forest and then be able to like to add such a component of camping, having some bonfire the evening, and I was going to say I'm a baffled singer, but like you bring that kind of talent on the campsite. So I think that's the exciting one, like the Karasimbi. It's a 2 day, and then the recent one, it was so good with almost everyone looking like they're at the top of the crowd. So it was a good experience in those aspects. The camping site, the songs, because we go with the guitar, and also it being the highest mountain in Rwanda, which by the end of the day excites everyone to be like, okay, now we go to East Africa, we go to Kilimanjaro, we go to Kilimanjaro in Tanzania, or we go to Mount Kenya in Kenya. So it's one of the exciting one. the fact that you are so much exercise, so much worked out, so much fun, but also such an excitement that yes, you are at the top of Rwanda, and then you look forward to being at the top of Africa with Kilimanjaro, maybe.
Wow. We look forward to your Kilimanjaro hike.
Yes,
And
before
Osazemen
I
you when
travel.
it comes to Rwanda as well. Thank you so much, Aimable. So we're going to thinking on these initiatives, these cross-cutting initiatives that can prevent diseases, but also, it's preventing diseases, but it's also almost inspiring. It's promoting us exploring, it's promoting us being healthy, all of that. I want to come to Joyeuse. I know Joyeuse has done a lot of work, research programs, policy, and Joyeuse, would love to hear your thoughts on what kind of initiatives are you seeing, maybe upstream or policy initiatives or programs that can help us to scale this kind of health promoting initiatives in Africa? What are you seeing that might be what it will take to actually do things like this on such a big scale that we have like a long-term impact on prevention, on life expectancy, just on a regional scale in Africa?
Yeah, definitely. I think Aimable did such a good job talking about how Rwanda has done it, and I think a lot of countries are also kind of taking those steps. So we've seen Car-Free Day arising in many different countries, whether it's to promote physical activity, and even the environmental factor as well is coming in, you know, trying to reduce air pollution and things like that. So we are seeing a lot of those country level initiatives. But speaking of policies, I think we are also seeing, especially the Africa CDC, take a leading role in more emerging policies. I think maybe moving away from physical activities, another aspect of healthy living is mental health, which is something that I'm really passionate about. And I know at EAF, we always cover mental health whenever we have any of the initiatives that we do. And most recently, we're seeing Africa CDC and even the African Union take a leadership role on implementing mental health strategies. So recently, they launched the Africa Mental Health Leadership Program, which is something that I've been following, where they're really aiming to increase mental health leadership, provide comprehensive training, expertise in mental health on a continental level, which is not something that we've seen before. And I think this is really exciting because, as we know, in the past, we've seen a lot of community-based interventions in mental health emerge. I think one of the ones that we've spoken a lot about at EAF is like the Friendship Bench in I believe Zambia, where they've used a community approach. No, in Zimbabwe, where they've used a community approach. They use grandmothers to provide a form of therapy for people. So you just go on a bench, sit with someone, talk and share your experiences. We've seen a lot of different initiatives that are happening in Uganda, Zambia, centered around providing, again, mental health therapy. There's a program called, I believe, Strong Minds in Uganda as well, that's focused on providing mental health services for women. So we are seeing that we did have a lot of these programs in Africa already happening in different countries, community level, but seeing such a big continental level policy being implemented, especially adding that value to mental health. I know there's been a lot of advocacy around how mental health intersects with physical activity, NCDs, healthy living, and all that. And so seeing such a big policy implementation on a continental level, I believe is going to be really valuable in driving us forward, and also in terms of how this plays into how different countries implement different programs. I believe that the tailored approach to different countries is still very important. It needs to be culturally appropriate, linguistically tailored to the different communities that the countries are serving. But seeing that kind of upstream approach and diluting down into the communities and taking that approach as a continent, I believe is something that is going to drive us forward in mental health. So I kind of deviated from physical activity, but again, even bringing it back to how we implement a lot of these physical activity initiatives from the upstream level, I think when we get to a point where we're seeing how we can implement this as a continent. I think one of the things that I really valued was the role of the Africa CDC during the pandemic. There was a really good streamline of communication that was coming from Africa CDC informing countries this is where we're at, contact tracing, masks, even with vaccines, although there were still some challenges, I think they really did a good job, especially in terms of communication and even fighting against some of this miscommunication that we're seeing emerge, especially around public health. So it is really important, and I think that will drive us forward. I think, yeah, just that the mental health programs that are emerging on the continent is something that I've been following recently, and is something that is exciting me in seeing how the policies are being implemented to promote healthy living on our continent.
Fantastic. Thank you, Joyeuse. It's nice to hear about some of the policy, like the regional initiatives and how they actually create a push for more kind of national community-based initiatives and tying mental health to, it's still very much connected to disease prevention and, physical activity, chronic disease prevention and well-being promotion on Africa. So you talked about Africa CDC, you talked about I love what could you remind us the policy that you mentioned is being implemented by Africa CDC around mental health? I think that would be something that people would love to maybe look into.
Yeah, definitely. It's called the Africa Mental Health Leadership Program. And for those who don't know, Africa CDC launched a mental health strategy in 2023 last year. And again, this is in partnership with the Africa Union member states. And so I think, again, we're seeing that togetherness of member states agreeing that mental health is an issue that should be put at the forefront. So that was launched in 2023, and a key priority of that mental health strategy is the mental health leadership program that is really focusing on training policymakers, training health practitioners across the continent, especially to address mental health, but focusing again on the different local needs that each country needs to address in the way that works for them and their communities.
Wow, that's fantastic. It's nice to hear of these initiatives and also taking that upstream approach that creates the push for initiatives, but then also making room to develop the workforce and then also adapting these programs at the national and community-based level. I'm sure people are going to enjoy looking into this example as well. So thank you, Joyeuse. We'll come to Michee because we know that talking about adapting initiatives like Joyeuse talked about, the friendship benches, adapting initiatives, even during COVID, like working with a regional strategy, but then also adapting it, communicating with communities, especially now that we're dealing with a lot of misinformation. It's just so important that we're adapting initiatives to the community level. We know that you have a lot of experience with working as a community health worker, and you work in public health as well. So we'd love you to just share maybe community approaches that you're seeing working when it comes to taking these high level initiatives and then adapting them to the community level. What are you seeing when it comes to promoting health with communities? What are some best practices or examples that you're seeing? Over to you, Michee.
Thank you, Ebele and the team. Thank you, Joyeuse and Aimable, who just passed before me. What I can tell you to the community engagement, I know when we go back to the primary health care, two of 4 pillars of primary health care is about community participation and intersectoral collaboration, which is meaning if we just focus on community engagement. That's why I have to just emphasize on community engagement, because if we talk about promoting health in Africa, but we forget about community, it looks like we are talking nonsense, because now in Africa, you have a limited workforce. So if you have a limited workforce and limited resources, we need to adopt any strategy which we help which will help us to recover from that issue of workforce and resources. That one is the only way of using community. That's why I have recently go through so many papers highlighted the engagement of community in Rwanda when against this kind of outbreak from COVID to Mpox, then Marburg. So now the key to is community health workers. Community health workers is one of the tools from community members, but now it's not only about community health workers because even local leaders, they're working as like health agents to improve community health. That's the case. So if we want to address these public health issues in Africa, we need to invest more forces, more resources in a community-based intervention approach. When you say community-based, we are talking about community health workers, we are talking about community local leaders, and we are talking about community members. Those are the main point to address the just community health issues. By now, if we use community-based intervention, we are just promoting health awareness, disease prevention, but using less resources. But if we keep using those just public health policymakers using these central institutions to intervene for these outbreaks, it will require so much resources, and sometimes we fail using that so much resources. That's why I get a research from Rwanda intervention to just against these outbreaks through community participation. I come back to the point Aimable highlighted about Coffee Day. Coffee Day start with government officials, but it's not about government, it's not about diplomacy, it's not about business. This is about community health. But now, when we say about community engagement, we need everyone to be a stakeholder to change their own health. That's how things started. Now we have a business, mostly the businessman, the businesswoman, the other sector from finance, from different education. They all join a cafe day activity and they go home with a package of public, I mean, health skills, health set of skills, which going to improve their own health and their own family. That's the case. So from now, I can just recommend every country, everyone in Africa to keep focus on this community-based intervention using just this tool of community engagement. We still have so many challenge because even community-based approach requires some resources, requires some knowledge, require just requires those more resources, including human resources, financial resources, education resources. All those package needed just to make this community-based approach strength. So I can suggest if everyone go, because I can go in my village, attend the community meeting, and just express my ideas community as public health professional who want to just address this issue in my community. I can tell my community, please, you are no longer like a community member only, you are no longer a patient. Now you are a healthcare provider for yourself, for your family. That's why I can encourage everyone in Africa, in Rwanda, or the government just to invest in the community engagement and let community member work as stakeholder in health in Africa. That's the case for me. If we go for this, we will just overcome so many challenges in Africa.
Thank you, Michee. So you're talking about, if I understand you well, on the one hand, we don't have enough health workers, but we need community health. It's true because every crisis, there was COVID, there's Mpox, there's this, we need community health workers. And you're saying that when we train community health workers or when we train people in the community, that that knowledge isn't lost. They end up continuing the cycle, they end up being health stakeholders. Um, Thank you very much for that. So maybe let's explore this a bit more. I know Aimable wanted to jump in and share some examples of community engagement that he had seen as well. So we'll let you jump in there, and then we'll come to Adaobi to tell us some of the work. Sorry, we'll come to Ajoke to tell us some work around empowering young people as stakeholders in health as well. Thank you, Michee.
You're welcome.
Yes, thank you so much. I wanted to also build on some of the activities that are actually taking place on what Michelle talked about. And one of it is task shifting that has been helping in like promoting health, but also uh, um, actually also providing care. And one example in Rwanda is how the community of workers, I think something that Michelle has experienced in have been trained and then also gained respect and trust from the communities in Rwanda on various health promotion aspects. From them, community health workers being able to get the message on the health center level, or a health center is on administrative level, it's under the hospital. Most of the time, that's where the community health workers are managed, and then they're able to get training, be educated about various diseases, the symptoms, the management, and actually even some of the home-based care. And then we have what we call on a community level called inteko z'abaturage, if you want to learn some of the Kinyarwanda. And then it's like the community gatherings. These gatherings happens every other Tuesday and of the week. And then among the people who are to present in such community gatherings, we have a sport for a health leader. We have a sport maybe for a security in the village. We have a sport for someone in education, as much as also we have a sport for a community health worker. And then what the community health workers are able to do, um, they're able to extend the message on education, on symptoms, on prevention. Like currently, as he mentioned, we are currently dealing with Marburg. And then as much as the health doctors and nurses are educated about the symptoms and then how they have to teach in the communities, or even to expand the message on social media like the Minister of Health is doing, or on radio, the community health workers also are able to disseminate this information in the communities. There is also what we have called, I will teach you so many Kinyarwanda words today, is called igikoni cy'umudugudu, and that's the kitchen for the village. And that's where mothers who have children go attend on a monthly basis to learn about nutrition and how to prepare a healthy meal for the children. And they are mostly assisted by the community health workers. But like recently, I was doing a research on breast cancer stigma, and I have learned that actually community health workers use platforms like those. They are uh, providing education and training mothers to prepare a health meal, but also they use such a platform to teach women about breast self-examination, or to teach other even lifestyles they have to adopt. So on such a community level, where community health workers who are experts on the lifestyles of the community and on the way of life in the community, who are living day to day with the community members, are also empowered to be able to um, maximize on health education, maximize on prevention lifestyles, and then be able to 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 reduce that. And also, one of the another experience that I have learned is that, well, we know so many people in Tigray may be having lifestyles that don't help them remain physically active. But in the rural area, community members are cultivating. They are fetching water somewhere far from home, or they're not using transport like in the city, which put them to less activity. And then I have loved how the community health workers are able to contextually be able to educate some other risk factors, because the community members are now active. They're active with the day-to-day activities, but maybe they're exposed to drinking alcohol. They need to teach them about reducing salt or other risk factors. And then that itself, it is done well because there's such a context around these factors. And then what do I prioritize in the city versus what do I prioritize in the rural area where people are almost active because of the day-to-day activities. And then I need to tackle other risk factors or other lifestyles that may put them to risk of having some of the diseases. Those are some of the observation and the experience actually I've been able to see on a community level, where community members are empowered to lead some of the lifestyles, but also manage some of the condition even when they occur, because there is such task shifting, such empowerment of the community health workers who are on the level of the community. Yes, thank you so much. I think Michee want to add something as well.
Yeah, thank you, Aimable. You just gave us like great input about this community engagement. But I want to add another thing for the example of Rwanda. We are now only using community health workers to reach out to those remote area community. But let's talk about the city. We have those youth volunteers who are now working together to the Ministry of Health and the Rwanda Biomedical Center to address these various outbreak in the country. So in this time, we have youth volunteer for all market in the city, for all churches in the city, for all schools. So these are the people coming from different sector, but they are now committing themselves to be like healthcare provider in this surrounding community. This also, they can get a time. You can't believe that even in the church, there is a time when someone from the church who get that short training about health intervention or disease prevention go in front of everyone, talk about how to prevent, how the outbreak symptom. If you have this sign, please go quickly to the nearest healthcare facility. If you want to prevent it, please go through these procedures and make sure you are now preventing yourself from getting infected. That's the case in both Lilo and city community. We have so many activity which are going on just to improve the community health. Thank you.
Thank you, Michee. So we're really talking about how we can get creative at the community level to promote health, task shifting. Joyeuse gave us the example of the friendship bench. Aimable, I will remember the Kinyarwanda word you gave us. If not, we would have said it so everybody watching can look into it. But it's really nice to hear these examples of initiatives. I think Osaze had one to add as well, very quickly. And then we'll go to Joke, who will tell us about this in the context of working with young people.
Yeah, thank you, Ebele. I didn't really want to add terms of an initiative. I just wanted to bring it home, the topic of the community health workers. As someone that my mom is a community health worker in Nigeria, and listening to the examples that Michee and Aimable said really hits home, because I did grow up seeing her do most of these things like health promotion. So whenever there was vaccines for immunizations, or there was something in town that people need to know, especially when it comes to their health, she always had this way of bringing it home. And she goes to the street and talk to people about it, try to ensure that these people get vaccinated, because most people don't really go to the hospitals, especially in these small communities. They really are not aware of things that are happening. Most of them, it seems like they are segregated from what's happening in the world. Even if they are part of the city, but they still see themselves as they still look like they are excluded. So the opportunity for community health workers to actually take this information that they have, or they actually know about, and go down to the community, do the health promotion, encourage them to get vaccinated. Yeah, it's very important, and I did see why we need to keep investing in trainings for community health workers in different cities and towns. Thank you.
Thank you for that example, Osaze. So, Aimable, can you tell us the name? So we had the friendship bench. Tell us very quickly the name of the two initiatives in Rwanda so that our viewers can note them and learn some of your language as well.
Yes, there is inteko y'abaturage,
Okay.
and that's the community gathering that most take place on Tuesdays, and also there is igikoni cy'umudugudu. Igikoni is kitchen, umudugudu is the village, so that's the community kitchen that mostly help the mothers engage in a health meeting. I mean, a healthy meals for the children, mostly in the efforts of fighting malnutrition.
Fantastic. Thank you very much. So we will go now to Joke. Joke has done a lot of work promoting health with young people, adolescents. Joke, would love you to tell us about, again, inspiring examples and strategies you're seeing around bringing this idea home. If we don't work, young people are basically the future, and whatever we invest in their health is the future of health in Africa. So what at this level in working with young people?
Thank you very much, Ebele. So importantly, this is very crucial because young people, adolescents and young people, I call them AYWs. This is the stage where they are curious, they are observing, they're exploring. They are young and learning a lot of things about their environment. And it's very important because the behaviors they learn at this stage of their young age is what they carry on to adulthood. So if they learn how to smoke at 15, it is most likely that they will smoke even when they are 40. If you research has shown that most people that end up smoking in adulthood, they learn these behaviors from their adolescent age. So it's very important to target young people when designing interventions, especially in the context of mental health, behavioral health, and physical health. So very important. So I'm happy we are bringing up this conversation. And it's also important because study has shown that there's a lot of mortality, an increased mortality rate when it comes to alcohol-related deaths, traffic road accidents. For example, there's an increasing death rates amongst young people and especially teenagers regarding traffic accidents because of alcoholism. Most of them drink beyond what they can control, and they end up getting drunk and driving and dying, killing themselves. So it's really serious, and I think it's a serious public health issue, and including sexual violence is related to alcoholism and even tobacco use because most young people, they go out for events, shows, and get drunk, maybe parties, and then end up getting involved in sexual violence or being perpetrators of sexual violence at a young age. And from sexual violence, we can get into results like HIV because of, if the sexual intercourse, most likely when it comes to sexual violence, it's usually unprotected sex, and it can result to HIV prevalence and all that. So there are so many, there's so many issues around mental health, physical violence, and they are all interrelated. They are all interrelated when it comes to adolescents. And some strategies that have been very effective in addressing mental health issues and physical health, physical activity discussions around young people. School health interventions have been very effective because you meet a large population of young people in school at the same time. So it has been very effective in increasing awareness and strategies to cope with the mental health challenges young people face in Africa. So, of course, when it comes to school health, we need to reach not just the young people, we need to involve teachers, we need to involve parents, because when it comes to the school health, it's not just teachers, parents are also involved. So we need to design strategies that will reach out to teachers, parents, because these are people that come in contact with young people. So most of them don't have the skills to even address maybe their students or their children are involved in drug abuse. Most parents and teachers don't even know how to go about addressing the problem. So they need to be trained. And also, young people need to develop life skills. That's why there are so many interventions today around life skill development for young people. Self-esteem, training, time management, how to, be assertive, how to ensure you're assertive enough not to engage in a behavior that will harm you, like alcoholism or drug abuse, So a lot of young people also don't have these skills, and they need to be equipped with like life skills that will help them, stay away from such behaviors. And also not to leave out, because in Africa, there are a lot of people that are not enrolled in school. So not to leave out young people in communities, out of school children. A lot of community interventions are also coming up in Africa. But even if they are not sufficient, there's a lot more that is to be done. I think some in the area of sexual health, there are youth-friendly sexual and reproductive health services in communities, but there are not so many youth-friendly services regarding mental health services for young people. Normally in Africa, young people are discriminated because of their age and all that, and they're usually ignored when it comes to developing policies, health policies and all that. They're usually ignored because they are young, maybe, I don't know. For some reason, young people are ignored, and they are really not paid attention to when developing policies and programs for health. So there is need to, for policymakers to become aware of the need to pay attention to the health needs, the mental health needs, the physical health needs of young people, and develop policies that will target that population, because there's a lot of work that needs to be done. The adolescent age is very crucial in developing to become a normal adult, a healthy adult. What you learn from childhood, teenage age is what you become in adulthood. So there's a need to focus on that population when it comes to policy and intervention development. And when it comes to community health services for young people, like I talked about the youth-friendly services for sexual and reproductive health, there's need to develop the same kind of youth-friendly services that will also cover mental health, cover physical health activities for young people. That is not enough in Africa. And we need to design interventions that would, link young people to mentors. Like for the boys, they need male mentors that will help them to learn good behaviors and good life coping skills. And for the girls, they need female mentors too. So interventions around recruiting reputable and trustworthy mentors in communities that will guide these young people is important. And also there's a research gap, there's a research practice gap that exists in the design of interventions and policies. There are a lot of evidence-based research that are not utilized in intervention development. Like, for example, tobacco smoking. A lot of study have been done around tobacco, even for young people, but the results of this study are not used to develop interventions. They are not used to develop policies. They're just ignored. And there was a WHO report that said tens of millions of tobacco-related deaths would have been avoided if there was no research practice gap, if actual research that have been done in these areas were actually utilized to design these interventions and policies. So there is need for researchers and practitioners to align with each other and collaborate to ensure evidence-based research and policies are actually implemented. So basically, when it comes to addressing this issue around mental health, because actually I ignored suicide. Suicide is also on the increase, and it comes from mental health situations like depression, and it's becoming really high in Africa now. It's not just in the Western world. A lot of young people in Africa now are committing suicide. So there's a lot of problem. And I think young people, they need to pay more attention to this population. Interestingly, so that's what I will have to say. Let's focus on both school health and community health interventions. And interestingly, when it comes to mental health, again, for young people, because this is a special population, we don't have enough mental health providers for young people. When psychiatric doctors or psychologists, there's a lot of gap when it comes to mental health care for young people. And I think we should not depend on the doctors, the psychiatrists, or the qualified professionals. We can train normal people to provide these services. We can develop training interventions for people that are interested in promoting mental health wellness for young people. Train them, let them become equipped to help these people. We don't have to depend on the psychiatrists or the normal professionals we think, because they are not even enough. They are really underrepresented in Africa. We don't have enough of these practitioners. So it's important, like task shifting, task sharing, that is very important. And again, what I have noticed with interventions around young people is that they are not even involved in the design of these interventions. They are not involved in the implementation. They are not involved in evaluating. It's important when designing strategies for young people, especially in the area of mental health. Involve them. Let's know the problems they are facing. Let's do some kind of baseline research, qualitative research, to get their own opinions on what they need, their actual needs. Let's know because that will guide the development of interventions. That will even guide the success of the interventions. Let's involve them in designing intervention, involve them in implementing, involve them in evaluating the interventions. I think that will go a long way in developing successful interventions that will really make impact, because most of the time it's just the public health professionals or the intervention the NGOs that will just come up with something. No, let's involve these young people. Let's know their needs. Let's design interventions that will actually address their problems. And also mental health care and services should be developed and provided in schools and communities where these young people can access them, because sometimes they don't even know where to go to get mental health service. Most of them can be dealing with addiction and they don't know where to go to address it. They don't even know what their parents don't even have the skills to help them. And usually young people are just on their own and don't know where to go. So peer education is important when we equip young people so that they can help each other. That's an aspect of peer education, like just developing their skills around addiction management, so that even if your friend comes to meet you as a young person, I'm dealing with this, your friend can help you, okay, do this, do this, do this. And apart from the peer-to-peer relationship, we need to make these services available, mental health services available in schools, available in communities, like integrate them into primary healthcare system. That would go a long way. If there's a primary healthcare system that has units for young people dealing with addiction issues or other mental health problems, if there are services in the primary healthcare system in communities that can help them, that will go a long way, because it will be more accessible and just help them.
Okay.
to be able to get the service they need. Yeah. I think I've said a lot.
So you've given us a lot to think about. Youth-sensitive design of interventions, including young people in policies, working with schools because we have a lot of young people there, bridging the gap between the evidence that's actually there and integrating it. Building the skills, giving young people life skills because it helps them across the life course, but then they then serve as resource navigators for their peers as well.
Yes, yes,
Thank you.
yes.
So, thankfully, we have a teacher here actually. So
Oh,
we're
nice.
put her on the spot.
Okay.
Adobe, Adobe works with young people a lot, and like as Joke has said, like schools are a very big entry point. Not all young people are in schools, unfortunately, in Africa. But maybe Adobe, you can tell us about your experience as an educator working with young people in schools, and it would be great if we can hear examples of what you're seeing working. Like, what strategies have you seen working with young people to really build that promote mental health, promote physical activity, build healthy lifestyles that they can take going forward across their lifespan. Over to you, Adobe. You're muted. I think you're talking.
Thank you very much, Ebele. Joke has really said a lot in this regard. As it relates to mental health and interventions in schools, having worked with young people for a couple of years, adolescents, I've found out that this set of people have special needs that both the school, the community, and even their parents sometimes don't pay attention to these needs. And we found out that there is need to design strategies that could help them. You know, this is a stage of their life where they are so inquisitive. They have the issue of body image that they're dealing with. Some have been exposed to drug abuse, and some of them are just so inquisitive. They need to know a lot. So I think the school has a vital role to play here with regards to ensuring that this inquisitiveness is being harnessed properly. Because if it's not, like Joke said, the experiences they have at the adolescent stage is what will likely transcend to the kind of adults they will become in the future. So something I've seen that I've worked is the integration of one of the 3 dailies. If you remember, we have our 3 dailies of movement, making sure in every day you move around, helps the mind, helps to keep the mind well. Then we have the morning pages. Morning pages, I will not lay emphasis on it, but morning pages has been found to be very helpful, where you pour out everything that is in your head. You don't need to think about, you don't need to read what you write, just write it down. Clear the head, it helps your brain to work better. It's improving. But what I've been looking at specifically is the issue of mindfulness. Mindfulness, the integration of mindfulness practices in schools is very important. This could come in form of yoga. It could come in form of breathing exercises, incorporating these things. It could just mindfulness sessions so that structuring it into the regular school activity. I've seen it to be quite helpful. And even it has been helping in addressing issues of childhood obesity and stress-related diseases or issues in students. So it has also boosted their emotional well-being because sometimes they get to think deeply. That is a stage where they now start reflecting on the things they're getting right, the things they think they need to incorporate into their life, what they think they could do better. And these mindfulness practices I'm talking about in schools, sometimes they incorporate it as like it could be a 10-minute session where these children, maybe during playtime in the morning, depending on the structure of the school. So it could just be a session where the children are left to just think. They are not being disturbed, they reflect, just like someone that is involved in yoga. just that because it's a school environment, if it's someone that is at home, you could say listen to calm music while you think and reflect. But because it's in a school environment, it could be just keeping the environment serene, making sure that everywhere is very quiet, then reflect, and after that, it comes up with this boost of both energy, having a clear mind. Sometimes you now see the students have feeling a bit not so, maybe a kind of sober reflection, where after this activity, you now see them approaching the school counselor to talk about one or two things that has been disturbing them. Some students will talk about drug, maybe those that are already involved in it. They seek help. They feel that this is not right. You know, sometimes before this activity, you could talk to them. You could tell them that they are only human, that they make mistakes. Sometimes they wouldn't always get it right. We are here as a school to guide them through life. So, incorporation of these mindfulness practices, I've seen it to be very helpful in boosting the, let's say, the overall mental health of students. Because, like Joyeuse said, at this point in time, health interventions around schools, they are needed. You cannot imagine the level of things that go on in the school these days. I don't know, with this exposure to children are being exposed to gadgets, and they are not able to control what they see online. That's what we found out to be the problem. Remember, in our days when we were in secondary school, we didn't have access to most of these things. We only had access to maybe landlines. And of course, those things didn't have much harm, like what children are experiencing right now. I remember a child that got addicted to masturbation, to the level that the child now masturbates in class. We got so bad that it was just another student that saw it, and it looked odd and bizarre. And the child started shouting, "What's the problem? Why are you doing such thing in class where people are?" So by the time we now called the child up, we tried to find out what could be the problem. We invited the parents, and the child said that this all started with his phone. He was still very young, maybe a child. That was when he was in 7th grade. He was given a phone. You know, usually these things pop up. There is this advert of pornography popping up when the child is using the phone. So the child said that he was using the phone, and this pornography popped up, and he now went to the site to see what it was like. And before you knew it, the child had access to phone, a smartphone. The child had access to data subscription, and the child started watching pornography. And before the child knew it, it became like an addiction. You know, something that we get to the level of a child practicing masturbation in class is something that has gone beyond a level of control. So these mindfulness practices, sometimes before they are being done, the children are being encouraged, first of all, to understand that they could have their downfall. They could have places they feel they might not be doing so right, but they should just free their mind to think and reflect on whatever they feel that they are not doing so well, and they feel they could talk to an adult about it. And sometimes we found out that it has helped, because most times they now come back to confine in some teachers that they feel that this is someone I could talk to. It might not necessarily be the school counselor. Just some children have a way of liking one teacher or another for one reason. They could now come back and start telling you this. They'll tell you they need help. They don't know how to go about it. Because at this adolescent stage, there's a lot of peer influence. That's the problem children have at this age. Mr. A is doing it, Mr. B is doing it. So if I don't do it, it will be like I'm the only one left out. So this practice has really been helpful in both stress management and in different areas of their life. So I think it's something that could be adopted by various schools. Play is to a child what serious work is to an adult. So it could come during the playtime. It could come at any time the school deems that it's necessary that such things can come in. And I believe it will help in addressing most of these issues and things that are of concern that are going on in schools, especially in Nigeria and Africa, where we all come from. Thank you very much, Ebele.
Thank you, Adobe. So remind us of the 3 dailies. This is interesting. I don't think we had this when I was in school. So you said it's
Okay, yeah, the 3 dailies, we have movement, we have morning pages, and we
pages
have meditation.
and meditation. Wow. And this is something
Yes.
that's done across many schools at this point.
Yes, some schools, especially the private schools.
Okay. Fantastic. Thank you, Adobe. We're going
Well,
to take this now we're going to move over to Osaze, and we want to maybe get Osaze's perspective when it comes to, so every now and then we have these different sporting initiatives that occur across Africa, and it's almost like the world's eyes are on the continent. Everyone is talking about sports. Osaze has researched this topic a lot, and we want to get her perspective on how can we maybe use this push during these windows to promote health in Africa, and can this even be applied to other cross-cutting health issues? So, Osaze, over to you, your perspective on sporting initiatives and their lasting impact and how they can be harnessed for long-term change when it comes to health promotion in Africa.
Oh, thank you very much, Ebele. And yes, you're right. Sporting events have so much potential in helping a city or host city in doing well in terms of physical activity and sport. And this can come in different ways. It can be to promote physical activity in that region and across. It can also be to promote some cultural initiatives. It can also be used to promote some social initiatives, some health initiatives, and also help economic wise and infrastructural wise. And I think it depends how these events are usually planned. For most events, be it a mega sporting event or just a small, there's no small sporting event, but be it a mega or a major sporting event, there's always a plan for the long lasting impact, like what happens after. Because to host an event, even if it's not a sporting event, just to host an event, it costs money. But when you're hosting a sporting event, no matter if it's a major or it's a mega one, you are bringing people together from different locations to participate in a sport. So it's actually costly. So they always have to be a plan on what can we do that as a host city, as a host location, even when the participant has left, the city or that space can still benefit or can still harness the benefit of hosting this event. And this is where what majorly we see as legacies of sporting events. So the legacy is majorly what is left behind after hosting a sporting event. A very popular example can be the Olympic Games. So when a city hosts an Olympic Games, what is left behind? It's what can be seen as the legacy from hosting the event. And the planning for legacy always starts way before the event. So you start planning for the legacies, you start putting activities in place before the event, and there's always also have activities that comes after the event, and these are ways that you can ensure that that city properly benefits from hosting an event that's very costly. And I think in Africa we don't host a lot of major sporting events or a lot of but we host sporting events no matter how small. We have some world games that have been held in Morocco. We have the World Cup that have been held in South Africa. And we also have some like championship events that have been hosted in different cities across Africa. But one thing I really want to talk about is prioritizing the Active City program. And Active City is just majorly a city that is prioritizing physical activity in different aspects. So prioritizing physical activity in places of learning, in workplaces, in schools, and that is one of the things that we can harness as a continent. Many countries in Africa, or some countries in Africa, already have some elements of the Active City program that they implement. And this can come in different ways, and one way is the infrastructural development. So developing spaces for people to practice sports, and this can be sport halls or even open spaces where people can just take time It mustn't be sport. It can just be a place where you can walk, or it can be a place where you can practice mindfulness, like Adaobi said. A place that you can come with your friends and practice yoga. A place that encourages people to just come together and do something that keeps them active. Another one can be public sport programs, and this can be working with public schools or uh, public sectors, or to ensure that they have public programs that are beneficial to the workers, or for in terms of schools, beneficial to students. And this can be hosting running clubs, and beneficial to the city as a whole can be hosting running events. An example we can see in Lagos. In Lagos, they have the a marathon that we do, but it's not hosted particularly like the state is not the main host, but it's done in partnership with the state. And this marathon, it's a very big event, getting most people running from Kenya and other marathoners running in the event. So that's a very good example of that. And another way this can also be done is by partnering with sports clubs and organizations. So in every city, we always have private sport clubs or private organizations that are very focused on organizing or hosting sporting programs. And this is something that you can harness as a government or as a state, partnering with them, ensuring that you can also get more people to be able to access their facilities depending on the kind of partnership that you have. And these are just the different ways that you can promote active city in a city, and which is very beneficial for people in the city. Most of the benefits of having such program is that it gives people from different democratic and demographics access or room to participate in physical activity. So people that from the elderly to the young people that Ajoke talked about, and these people have access because there are different spaces, there are different activities for them. And it also builds a culture of well-being, a culture of physical activity in such communities. It also encourages movement and social cohesion because people tend to come together in these spaces or using this program or in this event. And it's also sustainable because even if there's a change in government, these facilities are usually still there. It can be, and it's not so big. It's something that just need to be incorporated into the system. And yes, when a government changes after 4 years, these facilities are still going to be there because they are not like expensive to maintain. They are just things that people can access. And I'm just going to give examples of some of them that are already happening in different African cities. I'd already mentioned Lagos. Aimable had already talked about the Car Free Day in Rwanda, which is a very, very interesting example. And even in Cape Town, South Africa, they have some initiative like outdoor gyms, open streets where people can run, and some of them have these cycling lanes. So having cycling lanes as a city, it's is a way to can promote this. People like Imable that love cycling, we're very thankful to have cycling lanes across the city. It means it gives them opportunity to cycle wherever they want to or wherever they want to go to, and they don't have to bother about whether it's going to be an issue with like sharing the road or dragging the road with a vehicle because there's a lane that have been given to the cyclist. And I know some cities in Lagos don't have this, but it's very essential and important if a city can actually work towards having such. We have a lot in Nairobi, Kenya, where they have some hiking and walking activities. And even in Accra, Ghana, they have some activities. And just to wrap up, lastly, we have activities in Addis Ababa, Ethiopia, where they have running, public running, and jogging activities in open spaces, and also some infrastructural designs that are meant to encourage people to participate more in sports, and also public campaigns around such topics. Thank you.
Thank you, Osaze. You used a term called building a culture of well-being, which I love. I think it encapsulates our discussion today. Thanks also for the examples that you gave us from different cities. It's nice to hear the East Africa. It almost seems like East Africa is leading on this, you know. So I think we need to catch up in West Africa.
Yes, and
So,
there's a possibility that there are some programs in West Africa that are probably not being so publicized. So that's also another thing.
yeah, so that's really awesome. I know we've spent quite a bit of time and we have we've covered a lot at this conversation. Thank you all for hanging in there. Before we wrap up, I think we will build on what Osaze said around building a culture of well-being. We're going to go around with each person, and you're going to make one wish. If you could make one wish, that will be granted around building a culture of well-being in Africa. Very quickly because we're over time, but just one wish for building a culture of well-being in Africa. What will it be? Um, let's go round. I see Joyeuse.
Yes, one wish is difficult. I was like, what is it gonna be? But I think I would say financial investment in community programs. So really putting the money into community health programs. Yeah.
Thank you. Michee, one wish.
I wish the same with Joyeuse. Everyone should invest in community health program.
Thank you. Aimable.
Yes, so I think most of the people whom we work together, they know that I always remind them to hydrate. And then it has been part of our hiking adventures. And yeah, access to water is something that will like help with yeah, the culture of well-being, because I face this a lot when I'm addressing some of the social determinants of health in the communities. So working around that access to water. Yeah.
Thank you. Joke.
Okay, I think I have two wishes. Okay, but basically,
Oh, you
I
have to
want
come to the
more.
next one to share your second wish.
Oh, yes, sure. I want more collaboration between researchers and practitioners
Hmm,
so that we can have more informed interventions that will actually be impactful in addressing um, challenges around adolescents and young people, especially regarding their mental health and their general well-being. Yeah.
Thank you, Joke. And Adobe, what's your one wish? Muted.
I think the involvement of the people that are meant to benefit from policies in the actual, on the round table where these policies are being made. Because I believe when they are involved, let's say you're making school policies around school health, teachers should be there, and at least students should be there. Because when their voices are part of the planning process, I believe they will come up with the actual challenges that they're having in the schools and classrooms, and this will lead to making of more effective policies. So involving the actual people that will benefit from the policies during the planning phases of these policies and projects.
Thank you. So what's my one wish? I think my one wish is just investment in prevention. There are too many stories of things that could be prevented, and it always annoys me. So whether it's the infrastructure that makes people healthy, whether it's the preventive approach to health system strengthening, I would love to see more of a culture of prevention in Africa. Well, we're on our way there with everyone here that joined the conversation. Thank you for the wonderful work you're doing and the wonderful perspectives that you've all shared. And yeah, this was fun. Thank you so much. And we hope the viewers at home also enjoyed the perspectives shared. Till next time, bye from Engage Africa Foundation.
Thank you.
Bye.
Thank you.